Hi, my dear doctors. We started studying about the anatomy of bone of the upper limb. So in previous video we started about the scapula. Now in this video we will study about the humerus bone. So this is what the humerus bone we can see anteriorly, we can see the medially, we can see laterally, we can see the posterior view of the humerus bone. So let's start from the anterior surface and the superior area. So we can see, and we start from the superior, come down on the anterior surface, then to the inferior, then we rotate the bone to the posterior view. So in front of us the area that we can see the whitish area here, okay, and it is a very smooth area covered by the cartilage surface to form a joint with the glenoid cavity of the scapular bone, and it forms the shoulder joint, which help in the rotation, in the movement, abduction, adduction, rotation, extension, flexion, okay, of the scapular, shoulder joint. So this area is called as the head of humerus. So behind the head of humerus there is a deep area which cover whole around the head of humerus, okay. This area, the deep area, okay, what we call here the C, you can see easily this area, okay. And this area is called as the anatomical neck of the humerus. The anatomical neck of the humerus. So behind the anatomical neck of the humerus, or we can say the near the anatomical neck of the humerus, there are two protuberance or two tubercles. This is what we call as the larger tubercle, and here the present the lesser tubercle. The lesser tubercle and the greater tubercle. In between them there is a sulcus. Okay, so this is what the greater tubercle, and the greater tubercle is a protuberance of a bone which help in the attachment of the muscle. So the most we can say the important muscles which attach at this joint, that is the infraspinatus muscle and the teres minor muscle. Okay, these are the two muscles which mainly attach to the greater tubercle. So to what about the lesser tubercle? So the lesser tubercle is also for the muscle attachment, and mostly the muscle which attach here, that is the subscapularis muscle, which is present on the interior view of the scapula, okay, and that muscle attach to the lateral border of the scapula and come here to attach to the lesser tubercle. So in between the greater tubercle and the lesser tubercle there is a sulcus. We can see that is the intertubercular sulcus, because it is present in between the two tubercle. So we can say that it is the intertubercular sulcus. So the structure which pass through the intertubercular sulcus, that is the long head of the bicep brachii muscle. The bicep brachii muscle present on the anterior compartment of the your arm, and the long head, it has two heads, long head and the short head. So long head mostly go through this sulcus, okay, go through this sulcus above and attach to the scapular area, okay. And the area which is present just below the anatomical neck, that is the surgical neck. So anatomical neck is present at the upper side, and little bit below there is present that this area is what we call as the surgical neck of the humerus. And below, if you go down, then we have an area here that start from the tubercle and comes down. So this is what the crest of the greater tubercle, that start from the greater tubercle, okay, and come down, we can see like this, okay. So this is what the crest of the greater tubercle, and opposite to that here again we can see the crest, and this is the crest of the lesser tubercle. So what the greater crest of the greater tubercle and crest of the lesser tubercle, in between you can see the sulcus, okay. So come down again. So if you come down, we have a structure here, okay, protuberance we can see. So this is what the deltoid tuberosity for the deltoid muscle. So this is what the deltoid tuberosity we can see at the little bit middle surface of the or the middle area of the humerus. We can see here that is the tubercle, that is the deltoid tuberosity. Okay, so come down again. So now we have a structure here, that is the anterolateral surface, because it is present on the anterior surface and the lateral surface. So flat area, little bit flat area between the crest of the greater and the lesser tubercle. Now the sulcus, okay, sulcus end here, and now it become a flat area. So this flat area is projecting or facing toward the lateral side and the anterior side. So it is called as the anterolateral surface of the humerus bone. So this is the anterolateral surface. Now a little bit down, the interior, this is what the anterior anteromedial surface is. So it's simple, it's not difficult. That is the anteromedial and the anterolateral surface. Now at the end, okay, the lower end, the point which is near the humerus, the radius and the ulna, and form the joint with them. So this area is the inferior area of the humerus bone. So in front of us there is a fossa, and this fossa is called as coracoid fossa for the ulna bone joint here. Okay, and below the coracoid fossa we have the trochlea, and this is the articulating surface for the ulna, so the ulnar bone joint to the trochlea, and it have the process, that is the acromion process. I will tell about that later. Okay, so now we have the coracoid fossa, below that the trochlea, and to the medial side we have the medial epicondyle, and above the medial epicondyle we have the superior or the medial supracondylar ridge. So we can see the projection of the bone toward the medial side of the body of the humerus both. Okay, so this area is called as the medial epicondyle. So above the medial epicondyle we have the medial supracondylar ridge, which start from here and go up like this. Okay, so we have a ridge like structure to the medial side. Okay, now we rotate it laterally. So if we rotate the lateral portion, then we have again the articulating surface, and this articulating surface form a joint with that of the radius bone, and this is the capitulum. So we can see the small area, articulating area. Okay, and this articulating area is the capitulum, through which attachment of the radius bone form a joint here, and above it is the radius joint to this area, the capitulum, and it also fit into the fossa, and this is what we call the radial fossa. So here we have a fossa for the radial, for the radius, okay, for the radius, and that is what we call is the radial fossa. And here we have for the ulna, that is called as the coracoid fossa. Now this is the inferior view, and the lateral view, little bit rotate like this to the lateral side. Okay, so we have a tubercle like structure, and that is the lateral epicondyle. So on the medial side we have the medial epicondyle, and the lateral side we have the lateral epicondyle. Above the medial epicondyle we have a structure or the ridge, that is the supracondylar ridge, and on this side again we have a ridge. Okay, the sharp area is going up, that is called as the lateral supracondylar ridge. So now we understand that at the end, at the inferior end, we have a structure, the trochlea, okay, for the ulna, capitulum, lateral epicondyle, and the lateral supracondylar ridge, the radial fossa, coracoid fossa, medial epicondyle, and the superior the supracondylar ridge of we can say the medial supracondylar ridge. Okay, so now we will rotate the bone toward the posterior view. Okay, on the back side. On the back side, we have here fossa or the groove, that is for the radial nerve. Okay, radial nerve come through like this for, okay, so this area, a groove like a deep area, that is called as the radial groove. So we can see here, this is the radial groove. Okay, come down, same. So this is the posterior view of the inferior side of the humerus. We see the anterior. Now we will see the posterior, the back side of the your elbow joint. Okay, so on the back side we have only one fossa. We can see here, that is the Olecranon fossa, and this Olecranon fossa where fit the Olecranon process of the ulna. So I said that the ulna joined to the trochlear bone. In the ulnar Olecranon process of the ulna attach here and fit into the Olecranon process. So it limits the extension of our elbow joint. It inhibit or the prevent the hyperextension of the elbow joint. And above that we have a structure, that is the posterior surface. Okay, it's nothing. So this is about the structure and the anatomy of the humerus bone. Thank you.